My name is Alan Rose. I'm 31 years old and I am currently living in Frankfurt, Germany, which is a bit of a change for me. I'm originally from the Washington, D.C. area, but I fell in love with the German man and made the international love affair work. And so now living in Germany, really starting my life over and seeing what it's like living in another place. Cancer was always, unfortunately, a word that was in my vocabulary from a really young age until now. My mother was diagnosed with the stage 3 invasive breast cancer at age 27. And then, unfortunately, 20 years later, she developed it in the other breast. And she passed away just after my 16th birthday. And so, really living a long part of my life, most of my life, as a woman without a mother, knowing that breast cancer was a part of my life. So it wasn't just my mother, it was my grandmother, my great aunt. Almost every single woman in my life had lost a battle to breast cancer, and I didn't want that to be me. And so for me, it was important to know my family history, to know my options, and to be able to take charge of my health care. I went public with my decision to have a preventive double mastectomy when I was 24 years old. And at first, I just shared this information with a friend, she shared it with a friend, and I ended up having this really intense viral story that went all over the world. It was 30 countries, 300 million homes, and before I knew it, I was sharing this decision with the world. And so through that journey, I was able to meet my breast surgeon. I actually did the Katie Couric show with her, which was unbelievable to meet my breast surgeon on a show like this. And so after meeting with a couple different doctors, I knew that she was the right one for me. And she was able to counsel me through this process to let me know what the risks were, what the benefits were, how I was going to be able to really move on with my life after this surgery. And she introduced me to my plastic surgeon, and I just knew it was the right fit. Sometimes you get that warm and fuzzy feeling with a physician where you say, they have my best interest at heart and they're here to help me. And I really felt like my surgical team was there to be on my side to help me move forward with the next chapter of my life. So I knew that going into a procedure like this, I was going to want to pursue reconstruction. As somebody who worked in the beauty industry, I was a former pageant title holder, I worked as a model. Being able to meaningfully reconstruct my breast was important. For me, it was really important to do my research, and I'm the type of person that likes to exhaust all options. I delve into the deep depths of the internet looking at all of the choices that I had. And it was also important to consult with my physician, and I did that, and that's when I found the Natrelle Inspira line. Being an advocate for myself also afforded me the opportunity to be an advocate for others, because it's like they tell you on an airplane, you put your mask on before you help other people. And it couldn't be more true in a situation like this. If you advocate for yourself, if you make the right decisions, you're going to put yourself in a great headspace to be able to help other people. And I feel incredibly fortunate to have that option as a brand ambassador, to talk to other women, to advocate for my generation, and to let them know that this is a procedure that they can do to prolong their life and to feel good and look good. The power of choice is so important. This is a tough procedure when you go through it, and to know that you have options and you have choices, and to be given the freedom to make those big choices for yourself, I think is really freeing. Because if you're forced to go into a procedure and you're not making the choices, it's being dictated to you, you're not always going to like the outcome in the end. But if you're given the option, you're given the choice, it's a really freeing feeling of being in control of your own body. Having the opportunity to let other women know that preventive mastectomy and reconstruction doesn't have to be this defining moment in your life. Having the ability to reconstruct your breasts really is, I don't know how you would say that, it's relieving.
Natrel breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrel breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrel breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrel breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.